You'll often hear people talk about the high of a substance or feeling euphoric from using a substance. And what we know about addiction is that it's really not about feeling good, it's about avoiding bad. It's both about avoiding the bad of withdrawal and then also avoiding sort of poor mental health symptoms or some other type of suffering. That's usually why people use. Some people talk about self medicating, and I think that's sometimes useful, but it's actually a lot more complex than that from a neurophysiology perspective. I want you guys to look at this graph, and we're looking at incidence of opioid overdose. And remember that this graph is probably undercounting people who die of opioid related overdose. This graph is probably not catching all of the deaths because we just don't have a good way to collect this data at a national level. Withdrawal management can be a safety risk and is something that herbalists shouldn't always try to tend to um, on their own. Because we're talking about fentanyl and opioids today, let's talk first about opioid withdrawal, which is not generally fatal. Opioid withdrawal is incredibly uncomfortable. Um, People have told me they wish they were dead during opioid withdrawal, but again, it's not something that we consider to be fatal. People have died from opioid withdrawal complications. Complications of opioid withdrawal, people have died, but it's not a common risk.